Thank you all who joined us. My name is Greg Kelly, and I am the president of SEIU Healthcare, Illinois, Indiana, Missouri, and Kansas. We will be hearing from a number of speakers. We will be hearing from a number of elected officials, workers from hospitals in the Chicago and Northwest Indiana area. And you will also hear from a faith leader in our community. And we're all here really to raise the issues surrounding hospitals and the workers in those hospitals, and really the dire situation that exists for many hospital workers in Chicago as well as Northwest Indiana. In this moment, in this time of COVID-19, it is important that everyone understands that workers throughout the care delivery system, not just doctors and nurses, but nursing assistants, medical technicians, food service workers, nursing assistants, every facet of the healthcare delivery system and hospitals are all at risk in this COVID-19 environment. And it's important that we hear from them, that we protect them, and that we give them what they need in this moment as they all seek to take care of us. And so again, you'll hear from a number of elected officials. Most importantly, you will hear from workers who are currently on the front lines, as well as faith leaders. And with that, we would ask our first speaker, Senator Robert Peters from the 13th District to speak to us. Senator Peters.
Thank you, Greg. So I'm here to talk about support and let the voices of those who are directly impacted really speak. So I've met and I've listened to low-wage frontline workers throughout this crisis. And all this crisis does is highlight something we've known for a long time, that oftentimes the working folks on the front lines are always ignored. And so more often than not during this crisis, we've heard from industries and CEO leaders, but not from the actual people who are doing that nitty-gritty work during a pandemic. So for us as elected officials, the general public, for everybody who's in management, we need to listen to the people on the front lines. We need to understand where they're coming from, and we need to make sure that everyone is protected, that everyone is lifted up, and everyone has the safety and dignity they deserve. When it comes to healthcare workers, they are telling us they need PPE, widespread testing for all hospital workers, and hazard pay. We can't just have a situation where we're giving round of applauses or, as they did in Las Vegas, flyovers. That's not enough. What we have to do is make sure that we're looking out for people who are looking out for us. And so for too long, for years, we've had people at the top benefit. And this is a time for everybody to get the things that they deserve and get that dignity and that love that we as a community deserve. So if we think about essential workers and we think about frontline workers and we think about flattening the curve, it needs to work where everyone gets the benefit. And what I mean by that is it can't just be a talking point. If someone has to do the work, they have to be protected. The other part about this is that when it comes to especially Black working class folks, say on the South Side, they're less likely to have the beautiful single family home that they have in Mount Greenwood. And they're most likely going to live with someone else who's vulnerable. And so it is important for us to think about this as a community public health policy. So PPE, widespread testing, and hazard pay is about protecting the community. It cannot just be about hoarding for a few people. Everyone needs to benefit from it. So I'm honored to stand here in solidarity with SEIU Healthcare. And I got to go here in a second, but thank you so much, Greg.
Thank you, Senator Peters, for joining us today, and we fully appreciate your comments. Our next speaker, well, we've heard the word hero and heroine get tossed around quite a bit here lately. We have long known that folks who work in healthcare and hospitals are truly heroes and heroines, and we are honored to be joined by one of our members who embodies heroism. He is a mental health aide at Loretto Hospital. He's one of our members who actually contracted COVID-19 at work, but he wanted to join us and tell his story. So I am honored to introduce Jeffrey Hagens. Jeffrey, can you speak for us?
Good afternoon. Jeffrey Hagens has been at Loretto for about 7 years. And I just want to say that things can be done a lot better as far as additional PPE to working staff. I work on a site floor where social distancing is not being taken care. It's not being used. It's non void, especially coming for the patients. We have been getting positive COVID patients day in and day out, and it's on days where we have four patients on the floor. They're two to a room. They're being congregated in their room where social distance is not being used. They have poor hygiene. There's poor manners. Then we tell them to go wash your hands, stand 6 feet or whatever. But a lot of them don't listen. And with the lack of PPE to the staff, we don't feel protected. Like, they give us a mask to wear. They don't give us a hand sanitizer. We have to provide our own hand sanitizer, or they give us gloves. And it's not enough. People been getting sick. My case is a little worse than others, but it's not enough. And something needs to be done about it. Like, we have to fight and scratch and claw to get the below basic necessities, and we're not getting it.
Hey, Greg, you're on mute.
Thank you, Neil. For those of you all that are on the call and you can't see via Zoom, Jeff is actually critically ill in the ICU, but he felt strongly that he needed to get on this call and tell his story. And so, Jeff, we are eternally grateful to you and wish that you are well very, very soon. Thank you for taking the time to get on.
No problem.
Our next speaker is another one of the heroes on the front line, Wellington Thomas, who is the lead RE tech at Loretto Hospital.
Good afternoon, everyone. Once again, thank you, Greg. I'm one of the lead ER techs at Loretto Hospital. I'm also a fellow steward. Along with Jeff, he is also a fellow steward at the Loretto Hospital for SEIU. And one of the things I want people to understand is this is very serious. This is very clear of what it's doing to healthcare workers who go to work every day, who go and strive to take care of patients. And I'm going to expand a little bit. It's not just hospital workers. It's also, you have nursing home workers, you have home care workers, people who's taking care of people, and people who's there to make sure their loved ones is taken care of also. So we have to keep that in mind. But of course, where patients come to get help is the hospital. And one of the things we do is we do take care of patients. The problem is, in this situation we're facing right now is, are we being taken care of? I want to say first and foremost, I do agree with Jeff. One of the things is, PPE equipment is coming in. However, one of the biggest things is how long is the PPE is going to come in and how they spreading them out. Some of the challenges I've heard from many workers is that it's getting the PPE, because it's so shortage that they're kind of rationing out. And at times, since they're doing that, well, guess what? We have to wait to go to our assignments. We got to wait to take care of patients. And you're still in an environment where patients come in and out them doors to be treated. So any moment, any second that you're in the hospital or, anywhere pretty much at this moment that you can contract it. One other thing I want to say is, you have as you guys seen, Jeff is in a critical situation. I want to really thank him for speaking his story. He really wanted to talk about what's going on, and I am so grateful for a leader that is in his department, and also his mother, Phyllis. She's working in the hospital. You know, that whole team upstairs work together, and they really thrive, and they're really pushing for Jeff to get better. We all know, we've seen certain situations in dealing with this, that this could be deadly. And Jeff is a soldier, and my prayers is out with him. But I want to make sure that we understand one thing, that besides our health, we doing everything we can to take care of ourselves. But at the end of the day, anybody, and I want to make that clear, anybody who work at hospitals does deserve hazard pay. Anybody who work with patients, nursing home care workers, child care, home care, anyone who's dealing with the public, with patients, you know, hazard pay is very serious, especially in the hospitals. You know, even nutritional services, they go on the floors, they drop off food. Anywhere in the hospital is very critical. And one of the things that we want to push is hazard pay, PPE, you know. And one of the last thing I want to say is, you know, testing. I've seen even several members in my department, you know, they're concerned about testing. You know, some of us could actually be carriers, and we can actually have it, don't show no symptoms, and we can go home to our loved ones, and guess what? They contract it, and they actually present symptoms and cause them to be sick. So how do we know we actually have it? And we understand that at the same time, most hospitals like we work at is a safety net hospital. So at times I get that it's a struggle. And one thing I want to say is that we do call on politicians. We appreciate Senator Peters coming in and speaking up, and we want more politicians to say, hey, we need more money to take care of these safety net hospitals. The safety net hospitals has to be taken care of, not just them, you know, not just here in Illinois, all over the country. It's very important. I think this is my message. Make sure that we have to take care of workers. We have to take care of our staff, especially we are the frontline workers at the end of the day. You know, we have the COVID unit, the ER unit that the hospital have specified, which most hospital has. But at the end of the day, we are our frontline workers. We are here taking care of patients, and we're being called on to take on a task that most people or some people already has dropped off. So won't you just take care of us like we should be? You know, we're taking on this fight. You know, you ask us to come to work every day. You know, you have facilities that are shutting down because of staffing issues, you know. And unfortunately, you know, facilities cannot control all staffing, but some of us is coming in to take care of these patients. Don't we deserve hazard pay? Don't we deserve PPE? And don't we deserve testing? And I think it's a clear answer. Thank you.
Thank you, Wellington. Our next speaker is a longtime champion for communities in Chicago. Our next speaker is Reverend Dr. Marilyn Pagan-Banks, who is the Executive Director of A Just Harvest, an anti-hunger and anti-poverty organization in Chicago. Reverend Pagan-Banks.
Good afternoon. I'm really honored to be here, and I just want Jeffrey and Wellington and others who are working to care for our loved ones. I want you to know that you're in my prayers, and I'm here today to join in this struggle with you, and for you. So, you know, we've been hearing a lot about this abundance of caution, and it's just surprising me. It's just actually just stifling to hear and to know that we're now taking care of our hospital workers. And I think that as we talk about an abundance of caution, in this case, we also need to be talking about an abundance of compassion. And that means making sure that we are paying hazard pay to our hospital workers and those that are working in the hospital, not, like they just mentioned, not just the nurses and folks, but all those who are in there every day taking care of our loved ones. I just can't believe that we're actually having to have a press conference and having to have this conversation. You see how elected officials move real fast to bail out corporations and business owners. And I'm not saying we ought not take care of our small businesses. We got to keep our folks employed. But the same ways that we work really fast to make sure that big businesses stay open. We need to move really fast to make sure that our folks who are on the front lines, in the hospitals, in the home care facilities, in places taking care of our loved ones, are given the resources that they need in order to do the work without being stressed out, anxious, worried, concerned about being able to pay their bills, about being able to pay for childcare, about being able to buy food and to support their own households. They're taking care of our loved ones. And so we're here today to say that we're going to stand with them to make sure that they are also taken care of. It just blows my mind that we're having this conversation. You know, I come from the Christian tradition, but I know that all traditions tell us that we need to act with justice, we need to act with kindness, and we need to make sure that we are taking care of God's people. And understanding that in this moment and at this time, there's just no excuse for not being willing to pay hazard pay, to provide hazard wages, and to make sure that we're taking care of our workers. And so, yes, we need to make sure that they have the PPE that they need, but we also need to make sure that they have the income that is due them in this work. The fact that they are showing up each and every day, 24 hours a day, to take care of folks like Jeffrey, to take care of other folks who are now facing this virus, but also those who are already in the hospital for other things. And so we're here today, Jeffrey. I'm standing with you. I'm standing with Wellington. I'm standing with others to say that the faith community is standing behind you, that we're not just praying, but we're going to stand with you, and we're going to be in this fight to make sure that you have what you need to be able to do this work. And we want to say thank you, thank you, thank you. And please know that we got your back, and that we are calling on the powers that be to say that you need to make sure you're paying a just wage to our folks. I was telling somebody earlier today that I always want to make sure that people know, like at a Just Harvest, for example, we're feeding folks who are working poor. They're working 2 and 3 jobs, but because of this wealth gap, and because we don't want to pay our folks, because we don't want to make sure that people have a living wage and can take care of their families, they still work every day and still have to come to our community kitchen to eat. And so this is a moment, you know, when we sanitize ourselves, and this is the moment for us to sanitize our policies and to make sure that we always are protecting those who do this work for us, those who are loving on our loved ones. We don't want that. We don't want them walking into those places stressed and worried when they're dealing with sick people. And we certainly want them to be able to come in with their full selves to take care of our loved ones. But how can they do that if they're worried and stressed out? So I'm here today to say that we are called to make sure that we are paying a just wage, and not just a just wage, but a hazard pay for our people. And it's not just prayers and thoughts are not going to be good enough. That when we have the ability to speak up and to speak out and stand with and to stand up for, that we are here to do that, and we are called to do that as people of God. So thank you for your work, and know that you're not alone.
Thank you so much, Pastor. We really appreciate your words of encouragement and your support. Our next speaker is Bernita Drake, a unit secretary at Methodist Hospital in Gary/Maryville, Indiana. As many of you know, our jurisdiction is Illinois, Indiana, Missouri, and Kansas. And many of the problems that we are facing as hospital workers in Illinois are also evident in Northwest Indiana. So we are pleased to have Bernita here, as well as who will be speaking in a moment, Senator Melton. But for now, Bernita Drake, a unit secretary at Methodist Hospital in Gary and Maryville, Indiana.
Hello, everybody. I am Bernita Drake, as Greg just mentioned, and I'm secretary at Methodist Hospital and have been doing this for 39 years. Right now, the people in the hospital are afraid. Our members are afraid. It's not just about the people who are working on the COVID units, because we have opened units at both campuses where people are being taken care of, and they are paying the nurses hazard pay, and we are working on something to get our CNAs paid as well, those that are working on the unit. But we need to pay everybody in the hospital. People are afraid that they're going to get sick. They have to take this home to their families and to their children. And we have workers who are asymptomatic, who are spreading it around our hospitals. Every single person who works in a hospital is at risk. We know it, but we keep coming into work because our hospitals can't run without us. And besides that, we come to work, most of them come to work because they have bills that need to be paid as well. To make sure that people keep coming to work, the hospital has to do everything that it can to help workers feel safe. For instance, my hospital listened to us when we said we needed to be screening people who come into the hospital. Everyone is supposed to get their temperature checked before they go in, but there are people who skip the line and say they're getting their temperatures checked on their unit. They could be sick and spreading, the disease through the hospital and screening people before they come in. We have to use the same elevators and work in the same spaces with the people who aren't being checked. And we all know that. That erodes the feeling of safety and fairness and cooperation that we need to get through this together. That's just one of the examples that we have, here at our hospital. One of the other ones is keeping everyone's, people are afraid and they're putting workers and patients in danger. It's not, like I said, just about the people that work on the COVID units. There have been plenty of cases where we have patients that come to the unit who have not been in isolation. They didn't have anything going on with them, but it turned out that they had to be moved, because they were COVID suspects. And then everyone, when they became positive, or even if they're transferring them to the COVID unit, but if they come up positive, we've all been exposed. We've all been in contact with those people. So that puts us all in danger. So saying that only the nurses and the CNAs working on COVID units are the only ones who deserve hazard pay because they are the only ones at risk, it's ridiculous. We're all at risk. So we're the workers on the front lines, and we know what is working and what isn't. My goal is to keep the workers safe and healthy so that we can take care of the people who need us. That's what's going to work for our hospital and for our community. So coming together and building together to try to keep people safe, get the proper PPE, and do what we need to do so that we can go forward and hopefully get through this. That's what we want to do. And I want to give a shout out to you, Jeffrey. Thank you, because I know that this is not a good time for you. We're going to keep you in our prayers. Thank you very much. Thank you, Greg.
Amen. Amen. Thank you, Bernita. Our final speaker is State Senator from Indiana. His district includes Gary and Methodist. We are honored to have with us from the 3rd District, Senator Eddie Melton. Senator Melton.
Yes, thank you so much for having me here, and just want to echo everything that's been said for the workers that have shared the testimonies. And Jeffrey, thank you again for sharing that with us today. We've called all our healthcare workers heroes, and that's most certainly true. But that's not enough. Just calling them that. We must listen to them as our heroes, and then help them to get what they need to fight this war on COVID-19. If they're telling us that they need PPE, if they're telling us that we need widespread testing, if they're telling us that we need to ensure they have hazard pay, then it's our job, and I say this to all elected officials on a local, state, and a federal level, that we ensure that they have these things. I can give you an example. The Indiana Senate Democrats, we have sent a letter to our governor urging him to take additional steps and make sure that all of our healthcare professionals and our essential workers across the entire board, not just in the healthcare profession, but all essential workers that's working through this pandemic, have the required and the necessary PPE, and enforcing those businesses and organizations to enforce the necessary practices to ensure that we stop the spread of this virus. This crisis is not going to end anytime soon. Our healthcare and essential workers, they're going to still be there on the front lines. They're still going to be there risking their lives and ultimately probably their families as well. So as they strive to continue to serve, we have to ensure that we're there to support them. They deserve to know that their leaders are committed to doing everything that they can to provide them a safe atmosphere. And we use communities and states like California, where California created a $25 million essential worker support fund to help those that's contracted COVID-19 and those that's been isolated because of COVID-19 and the potential exposure. Funds that help provide childcare for this population as well. These are the type of things that we have to be very intentional that we provide our workers, these frontline workers that's putting their lives on the line for us. So in Indiana, we're striving to do our best. However, we can do better. And I think this is going to be more of a collaborative and an inclusive process that needs to take place. We must be very intentional in developing ways to support these workers. Now, I'll say this. Right now in Indiana, we have, well, the governor has pulled together a task force, an economic relief and recovery task force, that's charged with administering the relief funds. It's extremely important that that task force is reflective of the communities across the entire state of Indiana. Whereas dollars from a federal stimulus perspective is funneled through the state, those communities that's been hit the hardest have representation in that decision-making process. I've heard stories from healthcare workers, I've heard stories from folks in manufacturing in terms of the implementation and the enforcement of the protocols and the best practices of safety. We have to ensure that all of these companies and hospitals are practicing to the fullest degree. So again, I just want to say thank you for allowing me to be here today. And I stand in solidarity with you all, not just here in Indiana and Illinois, but across the country. Thank you.
Thank you, Senator Melton. Really, really appreciate your support and look forward to working with you in the coming days. So that concludes the speaking part, but before we finish, we have 3 basic demands, and you have heard them throughout this presser. Number 1, all hospital employees should have enough PPE and that it should also be easily made available. Number 2, that there should be widespread testing available to all hospital workers. And number 3, that all hospital workers are entitled to hazard pay. And we believe that these are all reasonable expectations and demands for all hospitals. And we intend to continue to fight and raise the alarm so that these 3 things will become a reality. And with that, that concludes this part. Are there any questions for folks on the phone or on the Zoom?
Hi, this is Dave Heinzmann at the Tribune.
Yes.
Are you aware of any instances where hazard pay has been paid to staff like this?
Yes, we are aware of a number of places. Some places have given bonuses. We have hospitals that have said in principle that they agree with the idea of hazard pay, but have not actually implemented. Wellington, I think Loretto is one of those places where they have sort of said that they were going to initiate it, but have yet to do so. Am I correct about that?
So right now, the frontline workers, they're saying that the departments such as the emergency room and the COVID unit is getting hazard pay with some parameters around it now. However, they saying that they are planning on giving hazard pay a little bit further to the clinical departments. We are still waiting for more in detail of what that looks like. We was told that it was supposedly come out on Monday, but we're still waiting. You know, we've been talking about this, we've been fighting, so we're just waiting and see what happens on Monday and then move from there. And our goal is eventually to hopefully have the whole hospital get some type of hazard pay because, you know, like I said, we're all at risk here.
And I would add to that, there are a number of institutions that have said and have given hazard pay, but they've limited the hazard pay to individuals who are directly working with COVID-19 patients, which we don't think is sufficient. We think that all workers who work in the hospital are entitled to hazard pay because the virus doesn't discriminate. We think that all hospital workers are entitled to hazard pay in this moment. I think there is a question from Stephanie at Cranes asking Jeff, this question is for you, are you being treated at Loretto currently? is the question from Stephanie at Cranes.
Oh, currently I'm at a Rush Hospital right now. I'm not at Loretto.
Okay. Okay.
Hi, this is Becky Vivi with WBEZ. I also have a question for Jeffrey. I'm sorry that this has happened to you, and I'm just kind of wondering if you could share a little more about, how long you've been in the ICU and when you first felt symptoms and sort of what happened.
I've been in ICU for about 4 days. 4 days prior, I was feeling shortness of breath. I had a crazy fever, fatigue, weak. Like I couldn't do anything proper. Like I needed to force myself up to get stuff done, and it took forever for me to do things. So a friend of mine, pushed me, uh, gave me a drive to the hospital, whatever. I got tested on the spot for COVID-19, and when I got processed through the hospital, whatever, I think like a few minutes after that, it came back positive. So, but since I've been here, my breathing's getting a little better. The fever is gone. They've been giving me this trial medication during my tenure here. The bleeding medicine is working, but they're still monitoring my breathing to make sure I won't have to get intubated or be placed on a ventilator or anything like that. But other than that, they tell me everything is looking good, but they're still keeping me monitored.
Okay, thank you.
Thank you. Thank you.